Hi, students. I hope you guys are doing well. Thank you so much for joining today's Pre-Health Thursday. And today we have Palm Beach Atlantic University, and we are doing the diverse careers in pharmacy, and we have the awesome Pamela Newsome and Dr. Chip White. If you guys, before we begin, could please check the QR code or use the link to check in before we begin. But without further ado, I will let them take it away. Thank you so much.
Awesome. Thank you so much. We really appreciate the opportunity to be here and virtually. At that, I was just saying that as I was coming up the elevator earlier, I mentioned to some students that I was about to do a presentation for UCF. And one of our students, Sakiria Jones, was like, "Oh my gosh, I went to UCF." And so I was like, "Hey, do you want to come be on the call?" Totally joking. But she's like, "Oh my gosh." So the reason why I even mentioned that at the beginning is because as I'm going through this, there are some of you obviously that are attending university there but are from other places, for instance, in South Florida. And so, of course, if you're ever in the area, whether it's for spring break or just coming home for a weekend and might be here on a Friday or a Monday, please don't hesitate to reach out. Myself, our faculty, our students would love to welcome you to campus and just kind of show you around. And I think it's a neat opportunity to actually see, what we're only showing you on the screen. So, with that, I have just a few moments because you're not really here to hear me talk. But Dr. White has a lot of really interesting information to share with you about the field of oncology pharmacy. And definitely, we want to keep it open for some questions and answers at the end. So, just to kind of show. Uh, Palm Beach Atlantic University and the Gregory School of Pharmacy, there in the bottom right hand corner. You will see we're located in West Palm Beach, Florida. We have been here since 1968. And so the Gregory School of Pharmacy was started in 2001. So we're not super old, we're not super young, just, kind of like Goldilocks somewhere right there in the middle. And that means that we kind of have the ability to be flexible in a lot of ways and make decisions that are very pro student, very student centered in your career toward becoming a pharmacist. And so, we are there on campus. We have our own building, and it's 4 floors of pharmacy. I actually was just giving a tour earlier this morning, and the building was abuzz with activity. So, you're going to hear a little bit in a moment from Dr. White, who's going to kind of tell you why pharmacy, like why this particular field of pharmacy, and how either he chose it or it chose him. But I'm looking forward to that. But I want to talk a little bit about why Palm Beach Atlantic. Why would someone choose the Gregory School of Pharmacy? And a couple of things on here. As you go through the journey to deciding which pharmacy school is right for you, it really does come down to fit. And of course, as an admissions professional, I can tell you about all the great things that are happening at the university and here at Gregory School of Pharmacy. But what you really want to do is make your own decision based on the information that's available. And there's two very, very objective measurements that the field of pharmacy schools use. And the first is ACPE accreditation. ACPE is the Accreditation Council for Pharmacy Education. And their whole goal is to make sure that the schools of pharmacy here are providing curriculum that is meaningful and will move you forward in your journey and make you successful when you are out practicing. The second one is that bottom bullet, which is the NAPLEX pass rates. And if you are planning on applying to pharmacy school this cycle, there is no doubt that you have already gotten an email, a Facebook post, an Instagram post that new NAPLEX pass rates are out. And so, again, this is a first time pass rate on how well students were prepared during their years of pharmacy school to pass the exit exam. And so, again, you'll want to take a look at those. We're super happy at the Gregory School of Pharmacy because, again, on average, because the rates go up, they go down, and it's easy to be like, oh, this is the better school. This isn't the school for me. But to really look at an average and consistently over the last 6 or so years, we really have been in that 80 to 90% first time pass rate. We're currently the only pharmacy school in South Florida, in the southern part of the state, above the national average. And so we're really thrilled about that. We are a brick and mortar program with that one campus that you see there, the building in the back. We are a traditional 4 year program, 3 years in classroom, and then 1 year out and about doing your rotations. We pride ourselves on small class sizes. And what that means for you with an average class size of about 50 students is that you get a really good student to faculty ratio. This means that you will have countless leadership opportunities through all of the clubs and organizations that we do have here at Gregory. It also means research opportunities. And we have students from the P1 year step onto campus in August, and by December, they are well plugged in with faculty there doing research on a variety of topics. And so that's kind of neat that you are able just to jump in and create your own journey as you go through pharmacy school. Now, I will say that while we do require you to join at least one club, the research opportunities are not mandatory. So that is something that many of our students, especially coming from successful undergraduate programs, uh, really want to get involved at the graduate level, and those opportunities do exist. You will not, this word is not owned by Gregory School of Pharmacy, but Pharmally is something that was created that we use. And I really feel that here at Gregory that it definitely is true. And our faculty, our alumni, our preceptors at our rotation sites really all come together with the focus on you as the student. Earlier today, as I mentioned, I was giving a tour, and one of the things I do just for fun is to kind of walk around the back hallway where most of our faculty are. And 5 or 6 of them, just kind of waved and said hello. And, we'll talk with students and really make both them and their families feel welcome here. And that really carries through the entire time that you're here. If you have something, an area that you're interested in, we always recommend that you reach out to faculty and say, hey, this is the kind of area I'm interested in studying. I know we're not going to, necessarily cover it in the classroom. Who do we know that we can, get connected with to see if this is even something I'm interested in? And so I always pick on forensic pharmacy, which is a real thing. To say that you're not going to necessarily learn that in the classroom, but certainly if we have a connection point there among our 1,300 alumni, we're more than happy to make that for you. We also offer medical missions, and Dr. White could probably spend his whole time talking about that because he is so committed to being able to take the skill set that he's learned as a pharmacist and just as a great human being, right? To be able to go into areas across the globe, including right here in our own backyard, to be able to help people. The location I mentioned, we're in West Palm Beach. If you're from Florida, you probably know where that is. We are on the East Coast, just above Fort Lauderdale, and our location on campus and in our city is a very nice one. As I mentioned, or you can kind of see behind me, you have the opportunity, to walk over to the intercoastal between classes and just really kind of take a break from studying. We do offer a 4 day class schedule. Most Mondays are flexible learning day. Usually there's no classes held during that time. Occasionally it will be necessary. We also offer the opportunity for postgraduate residencies, which again are not required, a medical Spanish concentration, and then our MBA PharmD dual degree program, which again, you don't need to make a decision on those before you apply, but you definitely have the opportunity to pursue those as you go through the program. Just some photos as kind of as we close out. Many of you will want to know about next steps, and obviously you would use FarmCast to apply. We will be accepting applications through the deadline of June. So if you're not sure, you have time to consider and to make that a deadline, which will be in June. So I am going to move on to the next slide, and Dr. White is going to take over. And I'll check the chat and just make sure that there aren't any questions that have popped up and see if I can help out.
Did it work?
It did for me.
Oh, that's so cool. Look at that. Wow, technology. All right, cool. Well, welcome guys. Welcome guys. I love everything that Pam said because this school is pretty special. I mean, I wanted to come back and work here. So I'll mention the medical mission. Since you brought it up, I will spend about an hour and a half talking about it now. But no, I'm kidding. But yes, my name is Dr. Chip White. I'm an oncology pharmacist, and yeah, let's talk about what that means. There it goes. All right, a little bit about me. So I went to the other school in Florida, the University of Florida, for undergrad, and then I took a year off and worked in the hospital and several other places trying to figure out what I wanted to do. I wanted to go into medicine, and then a friend of mine from church went uh, to PBA for pharmacy school and said, "Why don't you check it out?" And I was like, "Well, I want to do oncology." He's like, "There's oncology pharmacists." So applied to PBA. I was born and raised in West Palm, and so it was a hometown school, and I got in, and I absolutely loved it. So graduated in 2017, and then after pharmacy school, you can do a residency similar to what medical residents do. About 70% of graduates go right into the retail setting, the community pharmacies, Publix, Walgreens, CVS, all those. About 30% of students, graduates go into do a residency. And so I did my PGY1, so postgrad year one, and my PGY2 in hematology oncology at WVU Medicine up in wild and wonderful West Virginia. It was an amazing experience. They actually, I mean, West Virginia is a poor state, but WVU Medicine is the second largest employer in West Virginia, right behind Walmart. We have hospital. They had hospitals all over the state, and so we had one of the best cancer centers in the region, and it was a pretty special time to be up there. But I survived 2 winters and wanted to come back home very quickly. And then a job opened up at Cleveland Clinic, Florida, here in downtown West Palm, and I was an outpatient pharmacist, oncology pharmacist, where I worked closely with 4 oncologists. I verified and dispensed and made the chemo, and then I went out and gave it to the nurse and sat next to the patient and talked to them about everything from their chemo to the name of their dog. So that was a special time for me as well. Yeah, and then COVID hit, and everybody worked there was kind of burnt out, and then well, then I'll actually let me back up. I was promoted to the lead pharmacist of revenue cycle because my clinic we had a $1 million inventory, and the powers that be came to me and said, "You're losing a lot of money. Like your inventory's all messed up." And I said, "No, it's not. One drug in, one drug out." And I made sure that nothing was expiring, everything was appropriate, and all of my resources were used appropriately. So they saw what I was doing, and then they promoted me to all of Cleveland Clinic, Florida, to make sure that from the time a patient came in the door to the time they left after their infusion, that everything was accounted for financially. So they promoted me. Did that for about a year, and then the job at GSOP at PVA opened back up. Actually, the current dean, Dana Strachan, when I was in school here, I went on 4 mission trips to Honduras with her, so she's become a buddy of mine. And when she became the dean at about this time, back in 2020 or so, she said, "Come teach my oncology course," and it's been an amazing experience ever since. So I've been all through um, working in the hospital, working outpatient, working as an administrative role, and now I'm in academia pharmacy, which is it's been a wild adventure, but I love teaching my students. So what does an oncology pharmacist do? A lot of what I do is screening and prevention. So talking to my patients who are going through treatment, and making sure that, well, we're doing the proper screening with colonoscopies and mammograms, and then genetic counseling and doing all those tests. And then I talk to a lot of patients about smoking cessation and other risk factors for developing cancer, all important roles for a pharmacist, especially with smoking cessation. Smoking was a risk factor and a cause for lots of different cancers, and a lot of people still smoke, even though it has been well established that it's not good for you. I'm directly involved with the oncologist as part of the team. It really does take a team to treat these patients and to care for them. So I work directly with the oncologists and the nurses and the dietitians and the insurance team and everybody to make sure that the patient is well taken care of from beginning to end. From a pharmacist specific role, I'm constantly reading the new guidelines, which provide the most up-to-date recommendations for treatments, and then literature. So any new clinical trials coming out and new journal articles about the latest and greatest, and they come out daily. Most other disease state guidelines come out every couple of years. Cancer guidelines are updated every month or two. And so it's a lot to keep up with, but it's really exciting to be able to read about the new trials and then go take it to clinic and well, be a part of giving it to a patient. I make sure that pertinent tests are done prior to treatment. So there's all sorts of tests. A lot of chemo damages the heart. Not a lot, but a couple do, and they require an echocardiogram ahead of time, and that often gets forgotten. A couple other genetic tests as well, but making sure that the patient is safe enough or healthy enough in order to receive chemo safely. And then all the cancer treatment is moving towards targeted therapy. And what does that mean? It's all sorts of genetic mutations are driving cancer. And it used to be before about 2000, 2003 when the first targeted therapy came out. Actually, it was in the late 90s when we actually mapped all of our DNA. It took us till the 90s to figure out every bit of our DNA, which is pretty exciting. And then we started to identify mutations that drive cancer growth. And with that, we can make certain drugs that target those mutations and basically turn them off or turn them back on. And so our body's able to uh, kill those cancer cells like it normally does. So that's the future of cancer treatments. And it's been really exciting to be a part of that and build those protocols and help those patients and all those fun things. Classic chemo has been let's give them a very toxic drug and then kill everything, including the cancer, and then stop it, and then their body recovers. And there's a lot of side effects, but these targeted therapies, minimal side effects and much more efficacy with it. During the treatment, I'm constantly checking in with patients to make sure that they're tolerating their chemo really well. It's interesting, a lot of patients are nervous to talk to their doctor about what's going on with them. They don't want to sound stupid or ask the wrong question or something like that, or they're embarrassed that they have a side effect or something like that. But when the oncologist asks them how they're doing, they say, "Oh, I'm fine." And then I go bebopping in after the oncologist, say, "How's it going?" And then they're like, "Well, I have this side effect, this side effect, this side effect." I'm like, "Did you tell your doctor?" No. All right. Well, let's talk about how you can manage that from an over-the-counter standpoint, or let me go talk to your doctor about what you just told me, and we'll make a plan for you. But it is interesting. They're more likely to talk to their pharmacist more than their doctor about side effects. But I then end it all saying, please talk to your doctor about it. The only stupid question is the one unasked. Oral oncolytic medications. So back in the day, back in like the 40s and 50s, when we were starting to discover chemo, they used to give toxic chemo as tablets, and it burned a hole through the patient. So they started doing it all IV, an infusion. But in the past couple years with targeted therapy, we've been able to just give um, tablets as their cancer treatment, tablets, capsules, things like that. And all of those, they're hazardous technically because they are cancer treatments, chemo in tablet form. But so they come from what's called a specialty pharmacy. And a specialty pharmacy is not like your normal on the corner supermarket pharmacy. It's usually behind closed doors. It handles the hazardous medications and the very expensive medications as well that a Publix pharmacy won't want to keep on their shelves just because the inventory costs are way too high. So oncology pharmacists are the ones who staff the specialty pharmacies because we also know how to manage and handle hazardous medications and safely for us, and then also dispense it to the patient safely, and then provide all that specialized cancer or specialized counseling as well. And as well as managing care. So once the doctor prescribes it, then those oral oncolytic medications or oral cancer fighting medications, oftentimes the doctor prescribes it and it's the pharmacist calling the patient, sending new refills, and helping manage side effects of that patient, making sure they're taking it when they're supposed to and answering any questions that they have. So it's pretty special that the oncologist and the pharmacist relationship has grown so much that they prescribe and then we manage the patient, which is really exciting. You're gonna move me out of the way. All right. So yeah, disease prevent progression to metastatic patients. So if you have early stage and metastatic cancers, and early stage, it's the cancer is still isolated to whatever organ it's in. Metastatic means it's spread everywhere. And so we watch patients for the disease progression. Typically, it's surgery and then a couple cycles of chemo, and then they're done. And then we monitor them very closely to see if the cancer has come back or has spread to other organs. So when they come into clinic for their follow-ups for all that stuff, I'm watching all their markers, all their lab tests, any imaging that comes back, and so I'm monitoring for disease progression just alongside the oncologist and the nurses as well. And then once that happens, I look at the patient as a whole, and then when it becomes metastatic, there's a whole laundry list of treatments we can now give, and then I work with the oncologist to come up with a specific treatment for that patient. Cool. Yeah, I love this is one of my favorite parts. I love supporting the patient. PBA is a Christian university, and so whenever I get the chance to pray with patients or just to be there for them, it's exciting. But what's also cool is I get to learn about all the different patients, and a lot of them are going through difficult times. And usually the patient though is like the one who's like, all right, let's rock, let's fight this thing, let's go. So couple weeks ago, we just had the big breast cancer walk downtown, raising money, Susan G. Komen walk. And it's always great to see all the breast cancer fighters. A lot of pink, first of all. And it's always great to see the breast cancer fighters and survivors. Just like if they've lost their hair, they have their pink bandana on, and they're fighters, and it's really exciting to see them. We have wig services in the cancer centers in case they lose their hair, but most patients are like, I'm going to rock my bald head because I'm fighting this thing, which is pretty cool. What I found though is their loved ones, their husbands or wives or their kids or parents too, if I or their kids with cancers, they're the ones who are much more scared, which makes a lot of sense, right? But I spend a lot of time talking to their loved ones as well, answering all their questions, giving them another line of support. Because if I can explain it to 4 or 5 different people and provide different resources to all of them, then I know my patient is well taken care of. The growing area, specifically for what I did with the revenue cycle, is patient and financial assistance programs. So for low income or uninsured patients, so in South Florida, we've got the richest of the rich and the poorest of the poor down here. And so I spend a lot of time with low income uninsured patients, finding them free drug through foundations or through the drug manufacturers themselves. So if patients meet certain income requirements lower than, then they can get free drug from the manufacturers. And the manufacturers, it's a drop in the bucket from they're not losing any money off of it. They want oncologists prescribing their drugs. But if they can get it to some of the oncologist patients who can't afford these drugs, then we can do that. I work on that a lot. It takes a lot of time. The patients have to fill out a lot of forms, show their income, and then the doctor has to fill out another form. And it's kind of like trying to, herd cattle sometimes, but we can get it done. And a lot of these new drugs are tens of thousands of dollars, but it's always really cool to see someone who has maybe just lost their job and doesn't have, or they're uninsured, to be able to get the best of the best and not have cost be a factor. Revenue cycle. So what that means is the revenue cycle itself is when a patient comes in, right when they walk through the door of the clinic until finally they walk out and everything has been paid and all the money has been distributed and insurance has been reimbursed and all that stuff. That's the end of the cycle. So I want to make sure from the time they walk in that the oncologist is putting in the correct diagnosis code. So when they diagnose a patient, they have to put in the right code in order for insurance companies to look on the back end and say, you put in that code, matches with this drug, we're going to pay you. I spent a lot of time doing that. And it was actually pretty fun, to be honest, because I got to tell my higher ups that no, I'm not losing money. I'm actually making you money, and I'm doing a good job at it. And then also being able to support my patients to be able to make sure that they didn't get a random bill in the mail saying you owe us $40,000, and I'm like, what? So preventing that, scaring patients, and also making sure that we cover all of our bases so that the patient pays the least that they have to, and we get we don't lose any money, which was very satisfying. Um, but it was a lot of work. And then the other thing too is end of life care. Obviously, a lot of people ask me, you work with cancer patients? That must be very depressing. A lot of times it is. I get to know these patients very well. But I do coordinate a lot with hospice care and pain management as well. So there are actually end of life care pharmacists, so hospice pharmacists, pain management pharmacists specifically. So I'll coordinate care with them to make sure that the patient has the least amount of pain possible and that they're taken care of in hospice as well, which is kind of morbid. But there was one time we had a clinic where one of the first times this happened to me, where a patient didn't come in for their appointment, and and then I was, it's like, well, they're late or whatever. But then the nurse pulled me aside and said, "Oh, we just talked to the patient's wife. They fell asleep and didn't wake back up." And I love that guy. We talked about jazz, anything from jazz music to Star Wars, and I'll never forget him. But that hit me really hard. And so the oncologist saw me, Dr. Grossman. He pulled me aside. He's like, "What's going on?" I'm just like, You've been doing this for 40 years, man. How do you do this?" And he's like, "I care for my patients. I know them, but I've had to learn to put up a wall, a boundary there with a good amount of margin so that I can care for them and love them, but I also need to protect myself. Because if I go down or I get burnt out or depressed or something like that, then I'm not able to come in and help people." I'm like, all right. So that's a balance you have to find for yourself. But it didn't stop me. I still wanted to go out and get to know the patients and learn everything from them, everything about them, name of their kids or the name of their dog and all that fun stuff. Right. So what else do we do? We take care of our patient, right? Number one, I tell my patients all the time, they're the number one person on their healthcare team. So they make all the decisions. We're all there to help them get through this. But specifically, I make sure that the treatment is ordered, all the doses are correctly ordered, everything is calculated appropriately. I have all the right lab values I need to make sure that their kidneys and their liver is appropriate and it's safe for their body to receive pretty toxic treatments. Do a lot of calculations. So if you want to be a pharmacist, please be good at math. With these, you can definitely hurt somebody. But and then prepared appropriately. A lot of these drugs can be kind of wonky because they need to be put in the right fluid at a certain concentration. And one time I had a technician make a drug wrong, busulfan, and no, etoposide. And she brought the bag out to me, and it looked like this beautiful crystal. It looked like a big snowflake in the IV bag. And she was like, "Is this right?" I'm like, "No. What'd you do?" And so I caught it, luckily. And she had put too much drug and not enough volume, and it just came out of the solution. And it was pretty, but it was like we should not give that to a patient. So I corrected her the way she made it, and then she put in the right amount of fluid. But things like that, catching all those things. And then what's awesome on the outpatient side, I get to follow a patient's progress through treatment, right? So I get to, every time they come in a week or two to get their next round of chemo, I get to check on them, see how they're doing, see how their dog is doing. I ask them all sorts of specific questions to see, looking for side effects or anything like that, and just being a resource for them as well. Because, the oncologists I work for, they see patients inpatient and outpatient. So they're seeing 40 plus patients in a day, and that's an 8-hour day. So there's not much time. But I get to go in after them. They spent 10 minutes with the patient, and he's like, and then he's on to the next room. And then I get to go in, and it's like, hey, I got 20 minutes to spare. Let's talk about everything, which is really awesome. I'm there for my patient and their loved ones to answer any questions that they might have and to support them through this process. So it's really special being an oncology pharmacist. I have time. Being an oncologist would be pretty sweet too. That's a long road. I have the time and I can go help my patient through this with supportive care, with managing side effects, to being a shoulder to cry on, to helping them with financial resources, and then end of life care. I spend a lot of time helping the families and the patients talk about things and go through things. When I was at West Virginia one time, they have like a 60 chair outpatient infusion center, and it's huge. And one of my favorite patients was there I mean, she was my favorite because I saw her a lot, but her cancer was going quickly through all the different treatments we had. And so I went over and talked to Dr. Shaw and I said, "Oh, so and so is here. I wanted to ask her about football and this." He's like, "Chip, you need to calm down. Let's go talk to her right now." And so we went in, and that it was the conversation where the oncologist said, Dr. Shaw said, "There's nothing else we can do." And then she started to cry, then I started to cry, and then Dr. Shaw said, "I have to go, but please tell the nurse if you want to talk to me." And then I just sat there and we just talked, and she told me about her life in West Virginia, and she told me how sad she was, but then we started talking WVU football, and it was a special moment that I'll never forget. So I was there for her, and then about a week later, she passed away. So anyway, moving along, but it does take a team to care for these patients as well. So pharmacists, nurses, dietitians, financial team, oncologists, and the patient is number one. All right. Yeah. And then let's see. I could talk forever. I haven't got to missions yet, but oncology is really split inpatient versus outpatient. Inpatient's more acute care. So if a patient has a serious infection or a side effect, or they're getting treated for one of the blood cancers, leukemia, lymphoma, myeloma, they might be getting more intensive chemo. And so we have to watch them very closely for a couple of weeks. We usually, leukemia is a cancer of the white blood cells. So we kill all the white blood cells and they're at risk for infection. So I watch that very closely, make sure they have the right antibiotics and stuff on board. And then we wait for their blood counts to recover and we send them on their way. There's also the hematopoietic stem cell transplant, otherwise known as bone marrow transplant. A pharmacist plays a huge role in that team because those are very, very high doses of chemo. And so I'm watching I look at the patient's body, their liver, their kidneys, how the body can receive the chemo and then get rid of it, and then watching for side effects and all of those things, doing calculations to make sure that they're eliminating the drug safely. It's very intense but very rewarding. Could also be a medical science liaison. So if you've heard of drug reps, where these representatives from the manufacturers come to hospitals and pharmacies and clinics and bring us lunch, but also try to get the doctors to prescribe their drugs more. Uh, what they found is pharmacists are more effective at that, so they pay them a good amount of money to go out and talk to doctors and other pharmacists about using their medications, which is nice because I can talk to more of a peer and talk more in depth about the drug instead of a pamphlet a sandwich that they brought me to try to get me to use their drug. But that's a very big growing area for oncology pharmacists. Most of my co-residents have gone into that area. Well, it's more flexible working hours and a lot more money, so I don't blame them. Industry, so actually going into the creation of new drugs, pharmacists are in there as well. Specialty pharmacy, I already mentioned, it's the hazardous, high cost, need to be specially handled cancer drugs. Academia, that's where I am right now. I jump into academia and I love teaching students about oncology and just like you guys, telling them what I do and trying to get them excited about going out and treating their patients. So it's a lot of fun and I get to go on mission trips. I've been 14 times to Honduras on medical teams and I'm going to Guatemala in a couple of weeks. So if you want to go on a lot of medical mission trips, come to PVA because it is truly amazing. We have scholarships galore to help you guys curb the cost because, as we all know, patient or student loans are a thing, and that's fun. Cancer Center Administration, I did that with being the lead pharmacist for revenue cycle, but going into how the whole cancer center is running and operated, there's a pharmacist on that team as well. Hospice, palliative care, taking care of the patient towards the end of life, outpatient infusion center, like what I did at Cleveland Clinic, and then revenue cycle as well. So pharmacists play a big role in the finances of these drugs. There's an article from HOPA, so Hematology Oncology Pharmacy Association is the major organization out there. But in January of 2024, they have a nice article about the role of the oncology pharmacist is on the cusp of beginning to evolve and change. And this guy wrote it in 2024, and he's about 10 years behind because oncology pharmacist is one of the few areas in healthcare and pharmacy, especially, that there is a shortage of oncology pharmacists. You can get a job anywhere in the country being an oncology pharmacist, um, simply because the value of a pharmacist in cancer care is just astronomical now with new drugs coming out every day. We're the drug experts on the team, and so I spend a lot of time teaching the doctors, teaching the nurses about all of these different drugs and being in the decision-making process for using these newer drugs in our patients, which is really exciting. Other organizations and resources. So NCCN, the National Comprehensive Cancer Network, they're the ones who consolidate all of the literature and data and everything and put out guidelines for everything from how often patients should get their mammograms and colonoscopies through all of the cancer treatments and all managing all the side effects and everything like that. And it's like a 500-page PDF, but once you get the hang of it, I tell my students all the time, it makes a little bit more sense. But it literally lists out every single treatment option and then gives a discussion section and then gives the references too. So I love it. That's what everybody uses. The American Society of Clinical Oncology is well, that's the big, it's like the American Medical Association, but they're specifically for oncology. They put out guidelines. They have great meetings every year of all of the oncology healthcare workers. For pharmacy specifically, we have HOPA, the Hematology Oncology Pharmacy Association. It's a great place to start, great resources for students, for pre-pharmacy, pharmacy, and residents. So check that out. They have a great annual conference this April. It's in New Orleans, so let's go. I'll be speaking at it, which will be a lot of fun. And then NCODA is the National Community Oncology Dispensing Association, or NCODA, which is much easier to say. And that's a newer organization that's been on the rise and really bringing in a lot of pharmacists and students as well. Lots of opportunities for students. We have a student chapter of NCODA actually at GSOP. So if you're interested in oncology, we've got a lot of students interested in it. But anyway, I've done a lot of talking now, so I would love to hear from you guys. Any questions that you might have. So, okay, I can stop sharing.
Awesome. I did answer one in the chat about what sort of support
Oh,
services that we do have for our students. So hopefully,
oh,
um,
perfect. Yeah.
yeah, hopefully that was addressed.
We play basketball. That's awesome. Yeah. All right.
You've seen
Yeah,
Dean
if you want.
Jackson play back.
Oh yeah, Dean Jackson played for the PBA basketball team. But yeah, if anyone has any questions about what I do or the school or anything like that, I went here and I worked here. So,
And again, you can take yourself off mute if you're brave. McKenna.
Yes, thank you so much. That was an awesome presentation. I was just curious for students who may be interested as well, if maybe you could share some in-depth experiences or maybe things you did to kind of prepare to get ready to go. So maybe internships, any type of networking you did, anything in that area to kind of prepare yourself the best would be awesome to hear about. Thank you.
yeah, for pharmacy or to get into pharmacy school, things like that.
Yes, thank you.
Oh yeah, 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 absolutely. So, um, to prepare for pharmacy school, I did do a lot of volunteer work in the hospital as well. So everywhere, anywhere I could, I did everything from, I was an orderly in the OR, which was a lot of fun because just cleaning up that. And then, I was a phlebotomist for a while. So I go around and there's all sorts of little jobs you can get like that. So I draw people's blood for labs. And then right now, you could try get a job as a pharmacy technician as well. It's good experience just seeing workflow of a normal retail pharmacy, a community pharmacy, and get your hands on the drugs and learn. You can watch the pharmacist, you can learn from the pharmacist, and you'll get to know a pharmacist. And pharmacy truly is a small world. Yeah, I know all the pharmacists in Palm Beach County. A lot of them went to either Nova or PBA, but you guys are all coming to PBA, right, Pam? And and yeah, pharmacy is definitely a small world. So volunteering in a hospital, if you're interested in hospital pharmacy, or I would say getting a job as a pharmacy technician. That would probably be the biggest one, actually. So,
Thank you.
mhm.
And I actually was typing in the chat. Vivian asked, what does the weekly schedule look like? And I was saying, Mondays are those flexible learning days. So Tuesday morning, when you do come back in, there usually is an exam at 9 a.m. And then you would have class until about 11, and there's a break. We call 11 to 12 a professional hour.
Yeah.
where basically a lot of our clubs and organizations will meet during that time. We do a optional pharmacy chapel during that. I think twice a month we do that. And then you would go back in the afternoon for a second class, which would wrap up around 3:30. And
Mhm.
so we will have students that will stay on site and either study here in the Gregory School of Pharmacy, go over to our Warren Library and study. And then when they leave campus, that's it. We're done. We have other students that as soon it's kind of like y'all are too young to remember Fred Flintstone, but it was a cartoon. And at the end of the day, they pulled this string and this bird, prehistoric bird, like yelled. It was like a whistle blowing at 5 o'clock, and everyone left, the quarry that where they worked very quickly. Sometimes I feel like that's some of our pharmacy students. As soon as that class ends, they're in the car, a puff of smoke behind them with the car taking off quickly. And so it really is up to you what your day looks like in that instance. And then, of course, Wednesday, very similar, except there's no exam. Thursday and Friday, also extremely similar. So, with that being said, we are currently for our P1s operating with what's called a modularized schedule. So, one of the things that I will encourage each of you as you look toward pharmacy school is, modularized is basically where instead of 7 classes in a semester, you're focused on three at a time. And then when that first one ends, the fourth one comes in. When the next one ends, and I always say it's kind of like Legos, that fit together. So you're still doing the same classes, you're still completing the same amount of credit load. It's just in a um, more spread out. And so you're able to dedicate time and energy to those classes. And so that kind of, transitions you into a doctorate level graduate program. And so that's kind of the way our students will work. I will say that as you are investigating pharmacy schools, there are pharmacy schools that do have flipped classrooms, right, where you're doing your learning outside and then you're coming in and doing what would be considered homework traditionally. And so finding out really what works for you. I did drop into the chat a conference that's coming up actually in Orlando. Hopefully, you've heard about it on March 7th. All 7 Florida pharmacy schools will be there. We all work very well together, and we all are here really, to help you find your fit and where, you will end up eventually for the next
Mhm.
4 years.
Yeah.
So, Dr. White, did you see that question? The first steps to finding
Yep.
internships
I
and,
saw
and
that.
networking. And okay.
Yep. I said that and I saw that and then I just want to add what you said, Pam. Like, I chose PBA over other pharmacy schools just because it is like a family, like Pam said. And, you know, bigger schools, I love going to UF. I'm sure you guys love going to UCF. I just know I thrived at a smaller school, especially for my professional education, right? And, you're going to have 60, 70 students in your class. You've got your professors are on the third and fourth floor of Gregory Hall. We're either here or at our practice site. And I loved as a student just walking around the third and fourth floor and bothering my professors. And it turns out I was never a bother. They actually genuinely wanted to get to know me and help me with pharmacy stuff and life stuff as well. So that was really special. That connection that we have with well, with your professors and then I have with my students. So it's that special. But to answer your question, the first step to finding an internship and networking in general, you could, apply to be like I said, a technician at a pharmacy, and then you become a pharmacy student, you are an intern. But even before that, if your school has a pre-pharmacy society, join that. I spoke at PBA's pre-pharmacy society. Look at the resource that Pam sent you. And then two organizations you can look for if you're going to stay in Florida, the Florida Society of Health System Pharmacists and the Florida Pharmacy Association. So the two major organizations of pharmacy are ASHP and APHA. So ASHP is more the hospital pharmacists, American Society of Healthcare Health System Pharmacists, and APHA is the American Pharmacists Association. And then every state has their own chapter, and ours are FSHP and FPA. So check out those websites, see if there's opportunities. Some folks post technician jobs, student opportunities, and then each county and region of the state has their own society. So, like in Palm Beach County, we have the Palm Beach Society of Health System Pharmacists. I'm currently the president, so you've already started networking. But check out FSH. I can't really speak for FPA. But they have similar setup. But FSHP, if you go on the website, you'll see opportunities for going to a networking event or some other opportunity. They call them lunch and learns or other opportunities just to meet pharmacists and technicians and pharmacy students in the area. So we actually are having our first networking event next Thursday, and it's pharmacists, technicians, students, and pre-pharm students. So trying to do anything we can to well support you guys as you go through this process.
Okay, I wasn't sure if I was still on mute. The other thing I will say, I cannot stress enough how much LinkedIn has leveled the playing field. As the mom of a college freshman, if he is on a call and someone like Dr. White is presenting, he will immediately go to Dr. White's LinkedIn, and depending on how it's set up, sometimes you have to send a little message. Other times you can just follow. We've had students that have started following our dean, Dean Dana Strachan, and she'll come over to my office and say, "Hey, is there a student named so and so that's interviewing?" They've started following me, on LinkedIn, and have asked some really good questions. And so please, use that when you talk about networking. I mean, it really, you can do that in your pajamas from your couch, right? And so definitely, take advantage.
Mhm.
Thank you for putting that in there, Dr. White, because I was like, you were saying a lot of F's and a lot of P's,
I
and
just put them
now,
in the chat.
now, now
Yeah,
we can see.
yeah, pharmacy is alphabet soup, man. There's all sorts of stuff. But
It is.
yeah, actually it's funny you say that. I had a current P1 message me, what is it, last spring, a year ago. I've had a couple pharmacy students who are now in our program who, coming applying for our program and just added me on LinkedIn and then asked me some of the questions that you're asking. And then we looked out for their application and it was like, oh, yeah, I know them. Or they would mention in their application, I spoke to Dr. White or whatever. And it's like, yeah, 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 come talk to me. So, anyway, so that's also use LinkedIn. Like, I guess there's Facebook stalking and let's go LinkedIn stalking. Let's make it a thing.
And we don't get weirded out when it says, a student has viewed your profile, like McKenna has viewed your profile. Like
Yeah,
it's not like that. But
it
and
isn't.
again, we have a couple of students currently in Gregory that do have TikToks. I do not know what the
Oh
channel or
boy.
whatever it is called, but they do like a day in the life of pharmacy students often. So definitely I would encourage you to, use whatever you have available. I sometimes go on Reddit threads and read like what most of the stuff about us is fairly old. Nothing new necessarily, but use those resources, and then as questions come up, feel free to reach out because we just want, again, I can't stress it enough. We want you to find the right fit. And so you may say, well, I'm really looking for a pharmacy school that's attached to a hospital, right? And so you have these ideas of pharmacy schools in our state that are attached to hospitals. But then, of course, we have faculty, Dr. Gerges is coming to mind right now, who are like, wait a minute, we are attached to a hospital, not literally like, building wise attached, but Wellington Regional, if you're familiar at all with South Florida, has a very strong connection with PBA. So, again, those are the kinds of questions that as they come up and you're really comparing apples, to apples, don't make assumptions about, oh, well, it's a smaller school. They're not going to have as many resources, or the faculty may not be as qualified, or they're not as published. And we have some faculty, apparently including Dr. White up there, that are very, very world renowned in the fields of what they do. Dr. Shaheen with infectious disease,
Mhm.
Dr. Marsing, in conjunction with a Nobel Prize winner at Duke University. So they're here, and I think that the thing is that they're never going to walk into a classroom and say, "Hey, check out my research." Right? It's really about you. And Dr. White mentioned that he felt that when he was here as well. So really, you are the focus, and they love the field of pharmacy so much. It almost makes me a little jealous that I'm not involved necessarily. I'm pharmacy adjacent, as they say, but that they just have this wonderful career choice that they've made that has provided them with so many different opportunities.
Well said.
All
What's our
Right.
TikTok handle? I didn't even know we have one.
So it's not a GSOP one. It's one of our
Oh,
students that has it, and
oh, okay.
we've actually had students apply and show up for interviews and say, "Hey, is so and so here?" And I'm like, "Oh, do you know her?" And they're like, "No, I follow her on TikTok." The
Oh,
first time I heard that, I was like, "Wow, really?" And then three other students in the interview were like, "Oh, me too, me too." And so it was kind of crazy, but
okay.
yeah,
That works. Yeah. I don't have TikTok.
me either.
Yeah.
You would expect me to have TikTok, but anyway. Any
I
other
don't know. With you,
questions?
Pam.
Again, take yourself off mute or type it in the chat.
Mhm.
But just in case you need it again, I'm going to go ahead and drop our emails here where you definitely can reach out. Again, if you were, like, hey, didn't you say at the beginning that there was, a former UCF student that's about to graduate and go on to her rotations? Well, who was that? Let me know. We can make connections. If you live in the Treasure Coast, if you live in Broward or Dade, and are coming back home after graduation, and you're like, I would love to know how someone uses Brightline or Tri-Rail to get to campus, or I live in Port St. Lucie. Are there other students that maybe I could carpool with? Like
Mhm.
those are the kinds of things that really make or break pharmacy decisions. And I think when you are thinking you're alone and you're the only person that's going to be in the car for an hour every day, you may, be like, oh, I can't do this. I'm going to pick a pharmacy school that I might not like as much, but might be closer to where I live. Um, and so, please.